11:30 a.m. and 1 p.m. until 4 p.m. You
Okay.
can also email us at sexualhealth@regionofwaterloo.ca. Hi, it's the nurse. How can I help you?
Yes, this is Gary Thompson calling.
Hi, Gary.
Howdy. I just watched a video by Public Health Waterloo.
Yeah?
Yeah, Naloxone administration.
Okay, yeah?
With the, it's also got Waterloo University
Yes.
Pharmacy. Yeah, no mention of rescue breathing. And then it's got chest compressions in there too.
Yeah, so the way the reason it says that, it's kind of following what the Red Cross and St. John's.
Oh, no, they don't do that. St. John's Ambulance and the Red Cross has never told you to give chest compressions for a hypoxic patient ever. They have statements out that say to do the exact opposite.
So the new guidelines for CPR on individuals, and if you're comfortable to do the mouth-to-mouth, yes, for sure, and if you're trained on that, that's for sure, they promote that. But for people who aren't comfortable or maybe haven't had training, the new guidelines are just saying get that hard pumping as fast as you can. So that's why that video is following that. But for sure, if you are comfortable to do the rescue breathing along with the chest compressions, then you can do that for sure.
Well, wait a second. With the signs that the video teaches, the patient's got Cheyne-Stokes respiration, hypoventilatory meiosis. He needs oxygen. It proves his heart's beating.
I agree, but like I'm saying, is what the new guidelines are saying is as long as you keep that heart moving, yes, they do need the oxygen, but as long as that heart's moving, and EMS has been called, if a lay person is not comfortable, that's the minimum that needs to be done.
Yeah, but if the heart's beating, you don't need to move it. Then you'll cause a dysrhythmia. They got 100.
Then you put them in recovery. That's the suggestion. But like I said, if you are comfortable doing the mouth-to-mouth rescue breathing, then that's something you can definitely go ahead and do. They're not saying not to. It's just for those people who aren't comfortable and trained and maybe don't know, this is the minimum that you need to do.
I'm publishing the resuscitation guidelines. Dr. Aaron Orkin, he's the co-author of the 2015 AHA and ILCOR guidelines. He was at a coroner's inquest and says rescue breathing is the most important part. The Heart and Stroke Foundation wrote them a letter and said stop doing chest compressions for a sudden witness cardiac arrest for a lay person who's never been trained.
So, well, I'm just telling you what I've known and what I've done is learned in my training. I don't know anything beyond that.
Are you a nurse?
I am a nurse.
Then you instantly know. A nurse sees 1,000 respiratory patients before they ever run into a cardiac.
As a nurse, I would perform that, and any of us would perform that. This is based on a lay person who has had no medical training or no experience before.
Well, they do have experience. Once they see the video, they go, okay, chest compressions. Which you shouldn't be telling them to do in the first place, because you're treating acute respiratory failure. Your heart doesn't stop till severe brain anoxia.
Okay, so I'm sorry, I'm not the one that created the video. I am not in that program either. So
okay, could you get Kathy? Is Kathy McKenna still with Public Health?
She works for Public Health for one more day.
One more day? Could you tell her to give me a call?
Sure, I can. And it's Gary, you said?
Thompson, Thompson.
Yep. And what's your last name? What's your phone number, Gary?
647.
Yeah.
864.
Yeah.
6609. Is she retiring?
She is retiring.
Well, that's good.
Yeah, good for her. I'm a bit jealous.
Well, I'm retired too, but I'm not. I get paid to talk to politicians. It's a lobby for the minimum wage and change to the labor laws, and it's way too much fun. Doug hates me.
He's hating a lot radio.
Yeah, well, he hates me, but his staff love me.
Yeah, that's great.
Yeah.
Yeah.
Well, say,
so,
get Kathy to call me. Thanks a lot.
I will, for sure. Have you met her before?
No, I might have. I was in Waterloo, November the 6th, 2011, when Toronto Public Health went there and told you to give chest compressions. I was there in the day.
Yeah. Okay. I will pass that message along for you, Gary.
Thanks a lot. You have a good one.
Okay.
Bye-bye.
No problem. You take care. Bye-bye.
Bye. You fucking lie to me. Why do you fucking lie to me? You fucking lie to me. And it says, don't do that. Don't give chest compressions to a respiratory patient, especially, and their heart's still beating anyway. And secondary, well, chest compression is going to make sure you stay dead. That's all that. Heart and Stroke, the Red Cross, St. John Ambulance says, no, don't do that. Whatever you do. Remember, you have fun. You lie to me. Lie to me. This is the video. Waterloo.
Naloxone is now available from Canadian pharmacies without a prescription. Naloxone is a temporary antidote for opioid drugs, which include but are not limited to heroin, morphine, fentanyl, codeine, oxycodone, and hydromorphone. If you suspect someone has overdosed on an opioid, you may want to give naloxone if you see at least one of the following signs: not responding when you yell, slow or soft breathing, snoring, gurgling sounds, or not breathing at all, the body is limp, cold and clammy skin, bluish lips and nails, or pinpoint pupils. When someone has overdosed, stay calm and call 911. Each dose of naloxone can only stop the overdose for about 30 minutes. To give naloxone, start by breaking off the top of the ampule. Insert the needle and slowly draw the naloxone into the syringe. Inject the naloxone into a muscle in the person's arm or leg. You do not need to remove their pants or shirt. If the person is breathing, put them on their side to protect them from suffocating or choking. If they aren't breathing, start giving chest compressions to the best of your ability until the ambulance arrives. And finally, while waiting for the ambulance, remember, stay on the line with 911. If the first dose does not work in 2 to 3 minutes, give a second dose. Don't try to get the person up because they could fall. Don't put them in a bath or shower because they could slip, drown, or go into shock. And don't give stimulants like crystal meth because it can make them sicker.
That's instructions how to murder any breathing emergency. And that was an RN that gave that. And they know exactly that's murder. And why would you want to go around teaching people to do that? What is it? 35,000 people have viewed that video. And 113 gave it a like and 5 down. Unbelievable. Just plain unbelievable instructions how to murder any breathing emergency. And it's being done on purpose. Because a 5-year-old child knows there's nowhere in medicine that'll say do that. Naloxone doesn't always work. You got to give them air ASAP. Stabilize the patient. Might not be a drug overdose. God, bunch of mass murderers.